Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about genetic screening tools that we can use during pregnancy to determine a risk factor as to whether or not baby has any sort of chromosomal abnormalities going on. Now, I do have a few other videos on this, including ones that touch on all the different types of genetic screening tools, and specifically also videos for NT testing, and also my own personal experience with having abnormal NTs. You can also find that on my YouTube channel. But anyways, I thought I would make this video because I have seen a few comments talking about how inaccurate these screening tests are, because for one commenter in particular, I saw that she said that she had a negative test for the NIPT, as in it told her that baby was fine, but then baby ended up being born with trisomy 21. Now, something that I always try and explain to the patients that I scan for the Nuchals is the fact that this is just a genetic screening tool. What a screening tool is basically just us trying to determine a risk factor as to whether or not baby has any sort of genetic abnormalities, but it is not going to tell you definitively as to whether or not baby has a genetic abnormality. So the only way that you can find out definitively if baby does have any sort of chromosomal things going on is if you do a CVS, a chorionic villus sampling, or an amniocentesis. And both of these things are going to be looking at baby's DNA, and this is obtained through invasive prenatal testing. I mean invasive because with the CVS, they are going to go through mom's cervix and get the fluid so that they can actually test baby's DNA. And same thing with the amnio. But instead of going through the cervix, you are actually going through mom's abdomen to be able to obtain that fluid with the fetal cells in it. I have personally had both of these procedures done, and there is a risk of miscarriage with them. I think right now, with an experienced doctor, as well as how far we have come with these procedures, the risk of miscarriage after one of these procedures is less than 1%, but still, there is that risk. So that's why that is called invasive prenatal testing, as opposed to non-invasive prenatal testing is the NIPT, and that also is going to fall under the category of these screening tools, such as the nuchal translucency. And all of those ones, so the blood test as well as the NT at 12 weeks, those are all classified as non-invasive, because you can think of it as we are not invading into mom's body to try and get those fetal cells. But at the same time, that is why these genetic screening tools that we use, the NIPT, the nuchal translucency tests, any other blood tests that fall underneath that umbrella, such as the quad screen, all of those are not going to give a definitive answer, but instead it is going to give a risk factor. So with the commenter that I was talking about earlier on in the video here, with her results from the NIPT, if you are getting a negative result, as in you are low risk for having a baby with a chromosomal abnormality, that does not mean that baby will not have one. Essentially, what it means is that your risk is very low to be having a baby with a genetic disorder, and therefore further genetic testing, as in that invasive testing, is not recommended because of that risk of miscarriage. You kind of have to weigh the risks versus benefits. So in this case, the risk of having a baby with a genetic disorder is going to be much lower than what it would be to have a miscarriage with the invasive prenatal testing. So therefore, the risk is going to outweigh the benefit, and the prenatal testing that is invasive is not going to be recommended. Again, because these are only screening tools, we are not going to pick up 100% of cases. We are going to pick up most cases with these screening tools, and we are going to be able to detect if your risk is elevated for most cases. But at the same time, because these things don't present the same in every single case, as in the nuchal thickness isn't always going to be thickened on a baby with a chromosomal abnormality, the markers in the blood are not always going to be elevated or decreased for every single case of the chromosomal abnormality in question. All of these basically mean that there is a margin of error that we have to take into account as well. So I'm not making this video to try and freak everyone out who has had a negative NT test or a negative NIPT test. But at the same time, just because you are in the low risk category, as in your test came back negative, does not guarantee that baby does not have a genetic abnormality. Again, the only way that you would know this for sure is if you underwent the invasive prenatal testing that actually tested the fetal DNA cells. But with the non-invasive prenatal testing, what they're doing is essentially just looking at a bunch of factors that give you a higher or a lower risk factor of having a baby with a chromosomal abnormality. And that's where the risk of being high risk for a genetic abnormality, as in your risk is just increased overall, comes into play. Or for the majority of people, your risk is going to be lower or just low risk in general. But again, this is not going to mean that baby for sure has a genetic abnormality or does not. These risks simply indicate just that, the risk as to whether or not baby has something abnormal going on with it. And until you do an amnio or a CBS, you really will not know for certain. So hopefully this has cleared up a few things in regards to non-invasive prenatal testing versus actually getting a invasive test such as a CBS or an amnio being done.